Now let's briefly discuss about gestational diabetes. As you know, the screening type that we use here is universal screening. I'm going to screen all pregnant women. It is universal screening. When do we screen them? As we discussed in the first chapter of the antenatal care, I'm going to screen them at the first visit, and then again at 24 to 28 weeks. There are various techniques to screen. The government of India has given guidelines where we check with 75-gram glucose, and in this 75-gram glucose test, this is done irrespective of fasting status. Irrespective of fasting status, I am going to assess after 2 hours. If the blood sugar is more than 140, if the blood sugar values are more than 140, she is taken as GDM. Another test is our 75-gram GTT, glucose tolerance test, which is given by IADPSG. IADPSG. So, as per IADPSG, I am going to call the patient in fasting state and I am going to test in 0 hour, that is in the fasting hour. Then I give the patient 75-gram glucose, then test this after 1 hour and 2 hours. The cutoffs are 92, 180 and 153. So, what is the difference here? Here I am going to take 3 values and this is not irrespective of fasting status. Here the patient is in fasting state. In fasting state, I give the patient 75 gram of glucose, then test it after 1 hour and 2 hours. If any one of these values are abnormal, if any one is abnormal, I will call the patient as GDM. If any one value is abnormal, I will call the patient as Gestational Diabetes Mellitus. So, how to manage this patient? For a patient who is just having GDM, in that situation, I manage the patient initially with diet, which is known as MNT or Medical Nutritional Therapy. Medical Nutritional Therapy along with exercise. We ask the patient to continue this for 2 weeks. If the blood sugars are controlled, well and good, continue with the medical nutritional therapy. If not controlled, if the patient is not controlled, then you go to the next management. And among the medical management, the drug of choice, is basically our insulin. It is insulin. In an overt diabetes means the blood sugar levels are in the pre-pregnancy range. So, when you do the blood sugar, you see that the FBS is more than 126, PPBS is more than 200, or the random blood sugar is more than 200, or the HbA1c levels are more than 6.5. Or you do any form of glucose tolerance test, any of the values come out as more than 200. Suppose you did the DIPSI test that is given by Government of India. This test is also known as the DIPSI test. You do the DIPSI test and you find that the blood sugars are more than 200. You do the IADPSG 75 gram GTT test, then you find that any of these values are above 200 or the fasting is above 126. I'm going to label them as overt diabetes. Overt diabetes. So, in overt diabetes, the levels are in the pre-pregnancy range. So, it can cause more fetal complications. So, initially itself, I'm going to manage vigorously. From the start itself, we would be giving the patient insulin. Along with that, we will provide MNT plus exercise. So, if you have to choose one answer in overt, always choose insulin. If you have multiple answers along with this, you have an option with insulin, MNT, exercise. That's the single best answer. You go for that. If that's not given, one option is insulin, one option is MNT, one option is exercise, go for insulin. Insulin is compulsory because this overt diabetes patients or the patients who are having diabetes in the pre-pregnancy, before pregnancy itself, that is known as pre-gestational diabetes. Who is having diabetes before pregnancy, pre-gestational diabetes, these are the population who is at increased risk of abortion. There is more risk of abortion. There is high risk of anomalies that is associated. The most common anomaly that is associated is cardiovascular system anomaly, CVS anomalies. In CVS, most common is VSD. The most specific cardiovascular anomaly is TGA, transposition of great arteries. But the most specific anomaly overall, if they are just asking you what is the most specific anomaly associated with this overt diabetes or even patients who are having pre-gestational diabetes, now your answer is going to be sacral agenesis. Sacral agenesis, also known as caudal regression syndrome. Caudal regression syndrome. Sacral agenesis or caudal regression syndrome.